The healthcare reform signed into law this week is expected to have a big impact on medical coverage and patients' insurance needs over the next few years, and it's not too soon to start figuring out what some of the key provisions will mean to you. Our consumer specialist, Rick Romero, joins us with more on that story. Rick.
Well, Mark, as most of you know by now, many of the new health care reform provisions won't affect you until 2014. But that doesn't mean you shouldn't be thinking about it and even preparing your budget for the changes now. Here's what it means to you. Some 32 million people who don't have health insurance now will be required to get it by 2014. Imagine how that will impact the healthcare industry. Take doctors. There could be a shortage of them taking on new patients, so you may want to find one soon before it's too late. And how about health insurance premiums? Brian Gilder, a certified life underwriter, says expect premiums to rise.
The insurance companies are going to say to themselves, we need to put more money on reserve, because if we're going to have to start taking on everybody that comes to us and we can't discriminate against anybody, then we're going to have to set aside a bigger reserve account to pay for these claims that are coming up.
Another thing that might affect your family budget is the increase in the Medicare payroll tax for those making more than $200,000. But those on Medicare will be glad to know their prescription drug bill will begin to get smaller later this year.
That would be nice. I'll welcome any kind of help.
One provision in the new bill that has not been talked about much is a new voluntary long-term care benefit that would pay cash to people who get disabled.
Long-term care is essential. I mean, it's just that's where people will get wiped out of all their money, is paying for long-term care.
But you get the new benefit only if you pay into the long-term care program for at least 5 years. You can start doing that beginning in 2011, but you might want to think about budgeting for it now. And remember, if you are uninsured now, you will be required to pay for insurance, or you might have to pay a penalty starting in 2014. So again, start planning for the cost now. And also remember, you may qualify for a subsidy depending on your income. If you'd like to see how much you might get or have to pay, we have a calculator to help you. Simply log on to our website at abc7.com. Michelle and Mark, back to you.
All right, Rick, thank you.